At the end of my career, I couldn't be happier, and I never thought I would be ever able to say that. I love being here. I love the work that goes on here. I love the transformation of our teams, and it's a job that I look forward to coming into every day.
Even though we are a smaller hospital, we are part of a larger system. And that is what it will allow a young physician to grow and become confident, but also have the support that they need as they develop in their career.
Being a UPMC employee, I've always felt supported. And supported from the sense of having the resources necessary to make sure that I can be at my best to give my best to my patients.
In a lot of ways, UPMC has positioned itself cleverly in terms of having access points of care, having the right docs to do the right thing at the right time.
As the medical director for primary care, that is my goal, is to make sure that all of our patients that we see get the highest quality care. And we can only do that by treating each other with respect, having great teamwork, and really making sure that everyone feels like they have received the dignity and respect that they deserve.
When you talk about the job search, that's kind of what everyone talks about. Your partners are so important, and my partners are so important, and they've really been just kind of the best part of joining UPMC. I think all of my partners actually live in New York. And so if you live here, you really care about the area and you care about the people here.
I love being in central Pennsylvania. It is actually a very progressive environment these days. It is close to bigger cities, but not with the hassles of bigger cities. I find the real estate is way more affordable and less expensive as compared to the bigger cities.
We are so fortunate to be located in central Pennsylvania. It is a great place to raise a family.
Working in an area where there's a higher population density, certainly there are people from all walks of life. There's a variety of different people that I interact with every day. I find that to be pretty rewarding.
We came to this area for my husband's residency, and since then we went to other places for our fellowships, and eventually we decided to come back and settle here just because we were drawn to everything that central Pennsylvania had to offer. We liked the good schools, we liked the outdoor activities, the proximity to the large cities, the cultural events that we could go to. Hershey Park has great concerts every summer, which we really enjoy, and I think all that together makes for good living.
I'm here working at UPMC Lidditz Hospital. It's in a wonderful community hospital located in Lidditz, Pennsylvania. It has great restaurants, Lidditz Spring Park, and just is an amazing community that is very family focused.
I personally do like hiking. In the York area, my favorite park is Nixon Park. I take my kids there.
So one of the reasons I decided to work at UPMC Central PA was also the location itself. There's not a lot of traffic, there's plenty of lush trees and rolling hills.
So my family and I, we love to eat out. There's a lot of choices, whether you're in Harrisburg or Lancaster or whichever city you decide to go to. Really anything you want to eat, you can find it.
Along the river, City Island, which is home for the Senators. It's a minor league baseball team, and a lot of activities there.
They're very proud of their hardworking community, and it shows. When a patient walks into the emergency room, you can see the pride of walking into a hospital that's dedicated to their particular community. And you can see the same in different hospitals, from Memorial to Lidditz, to Carlisle, to Harrisburg.
So I think one of the benefits of working here at UPMC Memorial is that we are a small community hospital, but we still are part of UPMC, and with that comes the resources that come with a big university center. And so to have that support and that backup when you're taking care of a patient is it's very much appreciated.
UPMC is a really good system to go into out of training because there's already such a big system and infrastructure in place where you don't have to worry about trying to set up the logistics of running a practice and training techs and office staff.
I'm here at one hospital, however, I can reach out to any physician that's in any hospital, not only in central Pennsylvania, but also in Pittsburgh, and definitely feel supported.
The technology that UPMC has allowed has transformed the lives of our patients. We have integrative technology using artificial intelligence and software enhancements that allow improved, efficient care of patients. We are the first system in the nation that has rolled out a rapid EEG program across 7 hospitals. UPMC administrators recognized the utility and the benefit and allowed us and gave us the freedom to develop that.
We're lucky to have state-of-the-art technology here, and our facility is beautiful, it's spacious, and we have the latest updates on our EMR, which really makes life very easy.
I am constantly looking for ways to decrease the amount of work that our physicians have to do to get them out of the office. Using teamwork and using your staff as well as your physicians to answer questions, to give advice, we make sure that our physicians not only have good work-life balance, but have more time spending with their patients.
I'm a mom with 2 small children, and that they've really given me the ability to have independence in controlling my schedule.
I work 4 10-hour shifts, so having that day off during the week is very important to have a doctor's appointment, or if, when I do have kids, picking my kids up from school and not working weekends and holidays is very important so that I can be with my family and friends.
UPMC has allowed us that freedom to be able to be doctors but also be humans, to be APPs, to be nurses and still be human. And that's one of the greatest benefits of working here.
I think the fact that UPMC is community-centric means that the individuals that have fought and studied and worked all their lives to have the privilege to take care of patients can do that in such a way where they feel like they're giving back.
They are one group of hospitals that follow their mission statement and allow physicians and providers the ability to take care and manage patients with their resources.
I have worked at several other large health systems, and I am so grateful to be here at UPMC. The teamwork, the camaraderie, the support that I receive here at UPMC is far superior to what I've seen in the past in my career, and I feel very fortunate that I found myself here.